Welcome to the office.
How are you?
Good.
Welcome back.
Thank you.
So, we've been going at this for a little bit.
Mm-hmm.
You originally came for,
Lower back pain.
and you were told you had multiple herniated discs
Right.
causing your back pain. You couldn't bend forward.
Nope.
And we've been going at this for a little bit, like I said. We're after today's visit, our next visit, we're going to be re-x-raying and seeing where everything is at. How you been doing?
I've been doing good.
What's up?
I feel like I've been holding up pretty well.
Since our last visit?
Yeah.
Okay.
Yeah.
Anything new show up?
Nothing new.
Okay.
No.
All right.
Same stuff, but walking's been helping.
What does that mean, same stuff?
Like same slight irritation if I move a certain way, if I sleep a certain way, but nothing that's like the pain that I have experienced.
So if we were at 10 in the beginning,
Right.
where are we now?
Like 3?
Okay, not bad. All right, so we're going to continue on. We're going to talk about a few things.
Okay.
Because you know how I am, right?
Yeah.
And on one of our videos, we posted the cervical video.
Uh-huh.
And the cervical video, I'm going over your x-rays.
Mm-hmm.
And there's a lot of comments and funny comments of people like, how can he tell there's a ligament issue, number one, on an x-ray? And number two was, well, if there is a ligament issue in the cervical spine, why is he adjusting the cervical spine? Right?
Yeah.
So two things I'd like to address.
Mm-hmm.
Number one, we evaluated the x-ray based on the cervical x-ray. When I made that comment was based on what's called George's line. And in the books, the way we learn is if you draw a line on the posterior aspect of the vertebral bodies, they should all be contiguous. There was a separation in a couple segments, and I'm just going to go over here real quick. And if we look at this line here and this line, that's the disconnect. So it's almost like a stair-stepping effect, okay? You can see that now. They're not contiguous. So that's why I was saying there was some ligament stuff going on. Now, when we're adjusting in the Gonstead work, we're not doing a random manipulation. We're not putting you on your back like this, halt, right? And we're not doing this where we're popping everything.
Mm-hmm.
We're specifically adjusting the one we want. And you can give feedback after the adjustment, what it feels like, right? Do you feel when we're adjusting up here, you're feeling all this kind of rattle around?
No.
No, it's not. And I have a brutal comment.
Do it.
Don't ever judge unless you experience yourself. Right, Papa?
That's right.
So I just wanted to address that. Any questions?
No, I don't think so.
Ready to get started?
Yeah.
Okay, let's do it. So, got a little pimple on the spine. We talk about that being the stop sign for the subluxation. Starting at the base, 15 points, T5, T6, mid-back. How's your food been the past few weeks?
Pretty good.
Good? Clean?
Yeah, clean. More than before.
Right pelvis. Elf. Nope. Right pelvis. T5, T6. Head down, please. C2. All right, so this is going to be a good one to show the C2 adjustment with what's going on in her neck. C2, T6. Let's see now. Nope, it's down low. Static palpation, running the fingers down the spine. What I want you guys to notice also, if we look at her overall posture, this looks a lot better than where we started. Mm-hmm. It's more comfortable in this position. 2, 3, 4, 5, 6,
Owie.
6, 7, 8, 9, 10. Okay. Number 5. Come back slowly. 5 or 1? 2.
Oh,
yes.
Yeah.
3. No.
No.
2.
Yeah, for sure.
Okay. Right side.
That's fine.
1 second. Right. That one's fine, yeah?
Yeah. No, nothing bad.
A little lower. Nope, S2. All right. Stand up, stand over here, please. Walk it off, please. Keep walking. Let's watch the right SI joint. It's up, but it needs to come down a little bit more. One more time. So it goes up more than it comes down. So we're going to work on that S2. All right, have a seat over here, please. And we're going to start on C2. Sit back for me all the way. And C2, when we look at the X-ray, you can see it's posterior inferior. And we just want to set 2. We're going to do our very level best not to rattle the spine. C3 is wedged on the left, C2 is wedged on the left. Okay, let's do C2. Right hand up, put the seatbelt on.
Whoa.
So seatbelt is to stabilize the upper thoracic spine. It makes the adjustment a little bit more specific, less rattling. Make sure you're okay there. It's okay on the shoulders?
Yeah.
Okay, head down please. C2. We're going to be on the left side, C2 spinous, bifid, tuck the chin back, and I'm holding it a little firm, stack. As I laterally flex, you see I'm holding the contact. I'm not letting it go. Yes? You feel?
Yeah.
Yeah. I'm just talking out what I'm doing, and right there. That's a baby one. Not bad, right?
Yeah.
Down, down, down.
Oh.
Perfect. But did you feel it all here?
No.
All there, right?
Just right there.
Yeah,
Yeah.
exactly. Stand up, walk it off, please, once. And then we're going to go right side down. S2. 1, 2. And bending and all that has been fine, yes?
Yeah.
All right. Gabriela going to get the cobra. Baby one. Come up slowly. And let's go face down over here, please. 1, 2. Now, I do use the drop mechanism a lot, and the drop is to absorb the force. And S2. Nice and easy there. Gotcha. T6. 2, 3, 4, T6. You okay?
Yeah, just tickle.
Perfect. Walk it out. And come on back.
Sitting?
Sit, please. I thought you'd get the Bentley today, but I don't think we need it for you.
Yes.
She's like, yes. Head down, please. C2 is clear. Mid back is clear. Tailbone is clear. Mira. 1, 2. Bueno?
Yeah.
Better?
Yeah.
Right on. Better?
Uh-huh.
Right on. On your back.
Ow,
That one or
Yeah.
that one?
Well, both are pretty bad.
Both. So what we're doing is talus. We're evaluating the talus and put the feet together. Bring the feet back all the way. When she does that, the right one goes back more than the left, so the left one is actually worse. Feel that?
Yeah.
Also,
Yeah.
yeah,
But
both.
that one's way worse, yeah.
Left is way worse, but we'll do both. So what we're doing, working periarticular swelling, and there's a lot of scar tissue in there, right?
Yeah.
And
for
she's
sure.
so trying to keep a straight face right now. 5, 4, 3, 2, 1. Passive range of motion, dorsiflexion, plantar, dorsiflex, dorsiflex, dorsiflex with a little bit of A to P with the web of the contact. There it is. 4, 3, 2, 1. And now we're going to set the talus. Left talus, relax the foot.
Push it.
That's the home run.
What causes that?
Sprained ankle. Common sprained ankle, and I have a lot of videos on it. Common sprained ankle, or typically with a sprained ankle, we get up to 6 major misalignments. It all starts in the talus here, the ankle bone. The ankle bone is the keystone bone of the foot. It articulates the leg with the foot, and it connects. Now, as I was taught, 85% of all foot problems mechanically start from a misaligned talus. Hi, how you doing there? Good?
Yeah, good.
Right on.
You for checking in?
What's up, Shasha? Oh, sorry, we can't call her Shasha anymore. It's Sakina. Dad remembers, right? The videos, the Shasha videos. All right. Hi.
Hey.
How you doing?
So good.
Perfect.
Would you say that most of my back stuff is in one side over another?
Right now, a lot of it goes right.
Is there a reason for that?
There is, but
Oh.
it's energy. Right side of the body, male energy, career, business. Left side of the body, personal, relationships. Hips, anger. Knees, fear. Elbows, inflexibility. Shoulders, burdens.
Interesting. So it's the right side.
Fibula. Talus. Fibula. Turn to the side, please.
Which side?
Either side, I gotta do both.
Okay.
Calcaneus. Down. Arch. Other side, please. Calcaneus. Arch. One more. There you go. Awesome. On your stomach. All right.
Oh no, it tickles.
Coming off the third digit. You watch what she's going to do.
Don't say that.
Middle cuneiform. Perfect. Middle cuneiform. There you go. Walk it off. Okay. And last thing are the hands. Squeeze. So we're doing the lunate, scaphoid, ulna, radial head.
Sorry.
Lunate. Scaphoid. Squeeze. Ulna. Radial head.
Oh, what scared me? Sorry.
It's okay. Lunate. Scaphoid. What are the 3 stars for?
My sister.
Squeeze. Squeeze. Questions.
How do you know if I have a nerve thing in my like neck? How do you fix a nerve thing with a bone adjustment?
Easy. Good question. Let's use this model to represent, okay, whether it's the cervical spine or whether it's this. So let's look at first the cervical spine. And the way Dr. Gonstead described it, actually I'll use this one. The way Dr. Gonstead described it is subluxation nerve pressure happens first from mechanical misalignment. There are Sharpie fibers. They are fibers that connect the disc to the bone. They're like rivets. It was discovered by Dr. Sharpie. And what Gonstead found is the vertebrae will first misalign. Because it's anchored to that disc, it's going to take that disc material with it, dislodges off the nucleus, so it's not sitting on its pivotal ball bearing. It stretches those fibers, creates irritation. That irritation then pinches on the nerve. Okay. Now, it's not bone pinching the nerve. It's bone misalignment causes inflammation of the disc that pinches the nerve. Now, the correction, we are using the bony levers of the spine to reposition. That's why the adjustment is so different. Okay, our intent, all Gonstead docs have the same intent, 99.999%. Okay, and the intention is when we're doing the adjustment, we're not twisting, we're lifting and setting. So watch, as we do this, it reestablishes the joint mechanics of the bone on the disc. That reduces the inflammation and that reduces the nerve irritation.
Got it.
Next part is as it goes back and the longer it's not addressed, it starts to go inferior. The more inferior it starts to go, you see the angle on the x-ray, then the more it can create potential stenosis. Mechanical cause of stenosis. So again, it goes back to what? Adjusting, getting the pressure off. Now, in the cervical spine, you have these little bifids, right? It's a different shaped bone. So when we're adjusting in this area, and if you look, you can see the adjustments are so different. If I'm adjusting C2, my elbow has to be so far down to clear that facet.
Yeah.
So it starts like this, okay? This is C2, C3, C4, C5, C6, C7. So the angle of the elbow changes. The more experience the practitioner has, then it's all in the wrist. So we can do it just with the wrist. But ideally when you're starting, the vector is created by this. So if I'm adjusting your C2 like this, boom, it's clean. If I'm adjusting your C2 like this, then we're rattling stuff.
Yeah, that makes sense.
That's the difference. Cool?
Yeah. Thank you.
I'll see you in a little bit. So next visit, we're going to redo the x-rays.
Yeah.
Okay?
Okay.
Take care.
Thank you.
Awesome.